Okay, and then intraventricular hemorrhage, usually when we're talking about this bleeding into the ventricles, it's usually going to be presented in a premature newborn or a newborn that has a very low birth weight, usually less than 1,500 grams. Okay, so this is very classic for this intraventricular hemorrhage kind of initial presentation. Remember, if prematurity is going to be, before 32 weeks. Okay, so before 32 weeks. Okay, so it might be, a 28-week-old. Born premature. And so the location of the injury is at the germinal matrix. So here's the idea. The germinal matrix, it's very highly vascularized before 32 weeks. After 32 weeks, the vascularity decreases, right? There's more maturity. And so because of the high vascularity before 32 weeks, it can be prone to bleeding if delivered prior to the 32 weeks. Okay, so usually it's going to present very early, first few days after birth, classically with a bulging anterior fontanelle. The child might, they're going to give you other signs. They might say that the newborn has altered consciousness or very high-pitched cry. Maybe they have hypotonia, they're not moving around a lot, or they just recently had a tonic-clonic seizure. Okay, new onset focal neurologic deficits, all very classic. Now, just keep in mind, this isn't the only thing, in this age range that you might see. And we already talked about, if they have a forceps or vacuum-assisted delivery, and let's say the patient isn't, less than 32 weeks, then don't go down this road, right? It's going to be a distractor probably, but go back to what we talked about with the neonatal soft tissue injuries, okay? So if it's a full-term child that had a vacuum or forceps delivery, we talked about this in a previous lecture. I just put the slide here, but just make sure that, you keep in mind the history. The history is very important to help you tease out what they're asking.